If you're dealing with a dry, uncomfortable mouth, you're probably trying everything, sipping water, avoiding certain foods. But what if the very things you're doing to help are actually making the problem worse? In this video, we will identify the 5 most common and often surprising mistakes that sabotage your efforts. For each mistake, I'll give you a simple, science-backed smart swap that can start making a real difference in your comfort and taste within 24 hours. This isn't just about discomfort. When your mouth is chronically dry, food loses its flavor. Every meal becomes a chore instead of a pleasure. Worse, persistent dryness is linked to dental problems and difficulty swallowing. This is a common issue as we age, often linked to necessary medications. But it is not a normal condition you must simply accept. We need to be smarter than the symptom. We need to look deeper than just drinking a glass of water. If you enjoy practical, evidence-based tips that help you reclaim your vitality after 55, please hit the subscribe button right now. Let's make sure you never miss one of these essential guides. So let's dive into the first mistake. This one is perhaps the most frequent error people make, and it relates directly to hydration. You think you are helping, but you are not. Mistake number 1: chugging plain water. When you feel dry, the natural response is to grab a big glass of water and chug it down quickly. You drink until you feel full, and then 15 minutes later, your mouth is dry again. Why? When you drink a large volume of plain water too fast, your body processes it rapidly. The water rushes through and acts like a flush. Your kidneys work overtime, filtering out the excess fluid. Importantly, they also filter out essential electrolytes along with it. This leaves very little residual moisture to truly lubricate your mouth and stimulate your salivary glands. You are flushing your system before your mouth can benefit. This chugging habit creates a cycle of temporary relief followed by rapid dryness. It's a hydration trap. The smart swap for this mistake is simple yet effective. Nie messa sip, don't chug. Asterisk. Instead of slamming a tall glass of water, keep a smaller, insulated cup or even a thermos nearby. Take small sips frequently throughout the hour, allowing the water a chance to actually mingle with the tissues in your mouth. This provides constant, gentle hydration rather than a quick, filtered rush. But we can make your water even better. We need what I call wetter water. Try adding a squeeze of fresh lemon, a slice of cucumber, or even a tiny pinch of an unflavored electrolyte mix to your water bottle. These additions, especially the tart flavors, do 2 things. First, they slightly slow down how fast your body processes the water, allowing for better absorption. Second, that subtle tartness acts like a gentle starter pistol for your salivary glands. It signals the glands to produce more natural saliva, which is the body's ultimate defense against dryness. That natural saliva is thick, protective, and carries flavor much better than plain water ever could. Remember this: frequent, small sips of slightly enhanced water will always beat fast chugging of plain water. Make the swap today. Now, let's move to mistake number 2. This one is often lurking right in your bathroom cabinet. You might believe you are practicing perfect oral hygiene, but in reality, you are setting your mouth up for a miserable afternoon. Mistake number 2: using alcohol-based mouthwash. Many popular, brightly colored mouthwashes contain a significant amount of alcohol. This alcohol gives you that familiar, intense burn and that satisfying, fresh feeling. But that feeling is deceiving. Alcohol is a powerful dehydrator. It rapidly strips away the little bit of protective moisture you have managed to build up in your mouth. It essentially acts like a quick, aggressive evaporation agent. You rinse for 30 seconds, and for the next few hours, your mouth pays the price. You achieve quick freshness, but immediate dryness. If you look at the labels of many common mouthwash brands, alcohol is listed high up on the ingredient list. We need to cut this habit entirely. It is a massive roadblock in the fight against dry mouth. The Smart Swap here is crucial for oral comfort. Switch to an alcohol-free rinse that contains xylitol. Asterisk. Xylitol is a natural sweetener that not only helps stimulate saliva production, but is also excellent for dental health, as it is linked to reducing harmful bacteria. Look specifically for products labeled as dry mouth relief or alcohol-free. These products are formulated to be soothing and lubricating, not irritating and drying. Your rinse should feel gentle, not fiery. Another simple swap is using a saline solution, or simply water after brushing, followed by brushing with toothpaste specifically designed for sensitive or dry mouths. Check your mouthwash bottle today and make the switch if it contains alcohol. Now we move from the bathroom to the pantry for mistake number 3. This is a common trip up, especially for our viewers who prioritize healthy snacking. Mistake number 3. Relying on dry, crumbly, healthy snacks. You are being mindful of your diet. Perhaps you grab a handful of whole grain crackers, a large serving of dry cereal, or a plain rice cake. These items are often low in sugar and high in fiber, making them good for general health. However, for a dry mouth, they are pure torture. Foods that are dry, hard, or crumbly require maximum saliva to break down. If your saliva production is already low, these foods act like sponges, soaking up every last bit of available moisture and leaving behind a sticky residue. This forces you to either stop eating or wash every single bite down with liquid, further disrupting your hydration efforts. The experience becomes frustrating, and you associate the meal with discomfort, which can lead to avoiding eating altogether. The Smart Swap is to prioritize moisture and texture in your snacks. Choose soft, tender, and naturally moist foods. Asterisk. Instead of dry crackers, try a slice of avocado toast, soft cheese with grapes, or whole grain bread dipped lightly in olive oil. Instead of dry cereal, opt for a small bowl of Greek yogurt topped with a few berries, or a bowl of creamy, chilled cottage cheese. The protein content helps satiety, and the high moisture content of the yogurt or cottage cheese actively contributes hydration. When you eat nuts, pair them with something moist, like a small piece of dark chocolate or a sip of broth. Focus on snacks that practically melt in your mouth, not ones that require forceful chewing and scraping. This simple shift ensures your snacks are enjoyable and functional. This leads directly into mistake number 4. This one impacts not just your comfort, but your actual enjoyment of food. It's the reason why your favorite recipes suddenly taste muted and boring. Mistake number 4. Ignoring your nose and relying only on your tongue. When taste diminishes, most people instinctively add more salt or more sugar. They try to blast the remaining taste buds with intensity. But here's the secret. Most of what we call taste is actually smell. Your tongue can only sense 5 basic flavors: sweet, salty, sour, bitter, and umami. The complex, nuanced flavor of a cinnamon roll, a rich stew, or a ripe strawberry that comes entirely from the aroma hitting your olfactory sensors, which are right behind your nose. If you have any congestion, or if you simply are not utilizing aromatic ingredients, your food will taste flat, even if your saliva is perfectly fine. You are missing half the sensory experience. The smart swap is to become a master of aroma and seasoning. Don Piments amp up the non-drying flavor agents. We want to use fresh herbs and strong spices to compensate for diminished taste buds. Think about finishing your dish with a generous shower of fresh cilantro, basil, or chives. Use powerful aromatics like garlic, ginger, turmeric, and lemon zest. These ingredients release potent smells that travel to your nose, boosting your overall perception of flavor without adding excessive salt or sugar. You can also utilize temperature. Serving food slightly warmer enhances its aroma. For instance, a hearty bowl of soup releases more scent than a cold sandwich, making the experience more flavorful for a dry mouth. Always remember to use your nose first when preparing and eating food. Now we tackle mistake number 5, a habit so ingrained in modern life that it's almost impossible to avoid entirely. Yet, if you are struggling with chronic dryness, this habit is a significant roadblock. Mistake number 5, over-relying on caffeine and alcohol. Both caffeine and alcohol are diuretics. That means they encourage your body to excrete fluid. When you drink a cup of coffee or a glass of wine, you are signaling your kidneys to flush water from your system. If you start your morning with a large, strong cup of coffee and finish your day with a glass of wine, you are essentially dehydrating your body on a 24-hour cycle. This chronic diuretic use drains the systemic moisture your salivary glands rely on. Many people try to counteract this by drinking more water later, but they are playing catch-up against a constant drain. The worst offenders are those highly caffeinated sodas and energy drinks, which combine the diuretic effect of caffeine with high sugar content, further disrupting oral health. The smart swap is about strategic timing and moderation. Follow every diuretic drink with an equivalent amount of plain, hydrating liquid, and schedule these drinks wisely. Asterisk. You don't have to quit entirely, but you need to manage the trade-off. For every 8-ounce cup of coffee or every serving of alcohol, drink an equal amount of water, ideally that wetter water we discussed earlier, within the following hour. More importantly, confine these drinks to the early part of the day. Avoid caffeine after 2 p.m. and limit alcohol intake near bedtime. Why? Because the diuretic effects can worsen nighttime dryness, known as 5 sleep-related xerostomia. Nighttime is when your saliva flow naturally decreases anyway. Introducing a diuretic before bed guarantees you'll wake up with a parched, uncomfortable mouth. Try switching to herbal tea or decaf alternatives in the afternoon to break the cycle. Now that we have revealed the 5 major mistakes, let's put it all together into a powerful action plan. These 5 smart swaps are the foundation of your dry mouth recovery. We have identified the problems in your habits: chugging water, using alcohol mouthwash, eating dry snacks, neglecting aroma, and overdoing diuretics. And now you have clear, simple solutions for each. To cement these changes, we need to focus on what you can do right now to trigger saliva production. This is the promised payoff, the ultimate strategy to get your river flowing again. We are going to intentionally engage the natural biological systems designed to prevent dryness. This method involves using simple, natural stimuli to send a strong signal to your salivary glands. The best natural stimulus is Asterix, denatrix stimmentart, and sour flavor. Asterix, denatrix, denatrix, denatrix. Think about a very small wedge of lemon, a few drops of pickle juice, or a piece of sugar-free xylitol candy in a sour flavor, like cherry or green apple. The moment a tart or sour taste hits your tongue, your brain panics slightly. It interprets the sourness as a potential acid threat to your teeth, and its immediate response is to flood your mouth with saliva to neutralize the acid. This response is fast, reliable, and completely natural. The key here is asterisk small amounts, used strategically when your mouth feels particularly dry. This isn't a continuous habit, but a rescue technique. Another powerful technique is asterisk chewing. Asterisk chewing, even on nothing, naturally stimulates saliva flow because your brain anticipates food is coming. For the best, most sustained results, chew sugar-free gum, ideally one that is sweetened with xylitol. The physical action of chewing combines with the saliva-boosting properties of the xylitol. Keep a pack in your pocket and use it during times you normally experience dryness, like during a long meeting or car ride. If gum isn't suitable, simply chewing on a fresh carrot stick or a piece of celery can also help, as the crunch provides both moisture and physical stimulation. Finally, let's quickly address the medication factor. If you are over 55, it's highly likely that one or more of your necessary medications lists dry mouth as a common side effect. This is not your fault, but it is a factor we must adapt to. You cannot stop taking your prescriptions based on a YouTube video, but you can talk to your pharmacist or doctor. Ask them if there are any equivalent medications that are known to be less drying, or if adjusting the timing of the dose could help. For example, sometimes taking a drying medication in the evening can minimize its impact during the day. Always consult your healthcare provider first, but know that simply opening the conversation can often lead to relief. Remember, every meal should be a pleasure, not a struggle. By switching from chugging to sipping, swapping out your mouthwash, choosing moist snacks, using aroma, and managing diuretics, you are making evidence-based, powerful changes. You are not just masking a symptom, you are retraining your body. Take the first step today by tossing out that alcohol mouthwash. If this video helped you understand the mistakes you were making, hit the like button right now. It helps other people who are struggling with this frustrating issue find this essential guide. And make sure you subscribe to Silver Smile and Bites for more simple ways to boost your vitality and enjoy life after 55. You deserve to savor every bite. I want to address a few common questions and adaptations, particularly for our senior viewers. Many people ask about sucking on ice chips. While this provides temporary cooling and moisture, it is generally not recommended as a long-term solution. Chewing on ice can be hard on older teeth, potentially causing chips or cracks. A safer and equally effective swap is to freeze grapes or small chunks of melon. Sucking on frozen fruit gives you that refreshing coolness, plus a boost of moisture and flavor, without the dental risk of ice. Another adaptation involves eating certain challenging foods. If you love mashed potatoes, rice, or other naturally starchy, sticky foods, here is a secret. Always add moisture and fat. Never eat plain rice. Instead, stir in some flavorful broth, a pat of butter, or a healthy drizzle of olive oil to make the meal silkier and easier to manage. Similarly, if you enjoy dry baked goods, dunk them. A simple cookie or piece of toast becomes infinitely more palatable when dipped in milk, coffee, or tea. Just remember the smart swap about managing caffeine intake. The goal is to maximize the ease of swallowing and the flavor perception of every bite. For nighttime dry mouth, which is often the worst, consider setting up a bedside humidifier. The air in our homes, especially during winter or when using air conditioning, can be incredibly dry. Running a cool mist humidifier near your bed adds essential moisture to the air you breathe, which can significantly reduce that parched feeling when you wake up. Pair this with a quick, non-alcoholic rinse right before bed. This two-pronged approach, hydrating the air and coating the mouth, is very effective for restful sleep and comfortable mornings. Let's quickly review the 5 smart swaps we covered. 1. Stop chugging water. Start sipping wetter water. 2. Ditch alcohol mouthwash for a soothing xylitol rinse. 3. Swap dry, crumbly snacks for soft, moist, nutrient-dense options. 4. Don't just taste your food. Use your nose by amplifying aroma with strong herbs and spices. 5. Manage diuretics, spacing out your coffee and alcohol consumption and following them with water. These 5 changes are easy to implement today. Choose one mistake to tackle first, maybe the mouthwash, since that's a simple cabinet change. Once you conquer that, move to the next. Consistency is what truly wins this battle. You have the power to bring flavor and comfort back into your life. Start making those smart swaps now and enjoy that silver smile and those delicious bites. You might be thinking, this all sounds good, but what about professional help? That is a crucial question. We are focusing on simple, at-home nutrition and habit-based solutions. But if your dry mouth is severe, persistent, or is actively impacting your sleep or swallowing, you must bring this up with your dentist or primary care doctor. They can perform diagnostic tests to rule out specific underlying conditions or autoimmune issues that might be contributing to your xerostomia. They can also discuss prescription-strength saliva substitutes or medications designed to specifically increase saliva flow. Our role here is to maximize everything within your control: your diet, your hydration habits, and your environment, so that any medical intervention you may receive is as effective as possible. Think of our smart swaps as the foundation of health that allows any other treatment to succeed. If you are constantly drying out your mouth with alcohol rinses or diuretics, even the best prescription won't be able to keep up. Let's use the example of taste recovery. Many viewers report that their diminished taste, known as dysgeusia, is actually more frustrating than the dryness itself. We talked about using powerful aromas, But let's look at two specific flavor agents that work wonders, known as Stratton's acid and umami. Asterisk. Acid, often found in vinegars, lemon, lime, and even cranberry juice, brightens and cuts through the dullness that dryness creates. A splash of apple cider vinegar in soup or a squeeze of fresh citrus over fish can be transformative. It wakes up those surviving taste buds. Umami is the savory, deep, meaty flavor. Sources of umami, like mushrooms, sun-dried tomatoes, or a dash of Parmesan cheese, provide a rich depth that can make food satisfying even when texture and moisture are challenging. If a dish tastes bland, adding a complex umami layer, along with moisture, is often the secret to success. Remember, taste is fundamentally tied to texture and moisture. We are playing a game of sensory compensation. When one sense is reduced, we amplify the others. The smart swap here is to look at bland meals and ask yourself 3 questions. Is it moist enough? Is the aroma strong enough? Does it contain acid or umami? Answering those 3 questions can rescue almost any meal from tastelessness. If you found the distinction between the 5 mistakes and the corresponding smart swaps helpful, please hit the notification bell. We release new videos every week designed specifically to help adults over 5'5" live with more energy and enjoyment. Don't miss the next vital tip. We are now going to zoom in on a crucial point that ties back to mistake number 3, the consumption of protein. Protein is essential for vitality and muscle maintenance, particularly as we age. However, lean proteins, like plain grilled chicken breast or firm steak, can be the hardest foods to chew and swallow when your mouth is dry, further frustrating the loss of taste. The smart swap here involves simple culinary techniques that maximize moisture retention in protein. Instead of grilling or frying, focus on moist cooking methods. Braiding, stewing, slow cooking, and poaching are your best friends. These methods use liquid, broth, wine, or water to cook the protein slowly, resulting in tender, fall-apart textures that require minimal effort to chew. Even better, the resulting liquid is rich in moisture and umami flavor, providing a natural sauce to aid swallowing. Think about making simple chicken or beef stews. The liquid base acts as both the flavor carrier and the moisture agent. If you are preparing fish, poaching it in milk or vegetable broth keeps it incredibly tender and ensures it doesn't dry out. If you absolutely must have a drier protein, like a piece of roast, make sure every bite is coupled with a creamy sauce, a thin gravy, or a moist vegetable side, like applesauce or mashed butternut squash. The other key aspect of protein consumption for dry mouth is portion size and chewing mechanics. Instead of taking large bites, focus on smaller, manageable pieces. Chew each piece slowly and thoroughly. Remember, the simple act of sustained chewing is a natural saliva stimulant. Don't rush your meals. Savor the aroma, appreciate the texture, and allow your natural saliva time to do its job. This strategic approach to protein consumption ensures you get the essential nutrients your body needs without exacerbating the symptoms of xerostomia. It's a perfect blend of gentle nutrition and self-care. We are treating the dry mouth while nourishing the body. It all comes back to conscious choices and simple swaps. Keep these culinary tips in mind. the next time you plan your week's meals. Let's address the common misunderstanding about sugar. Many dry mouth products, like candies and lozenges, are sweetened, and that is where the confusion lies. We are not saying all sugar is bad, but mistake number 5, the over-reliance on high-sugar comfort foods, can severely worsen dryness and oral health. When sugar dissolves in a dry mouth, it creates a sticky, concentrated environment. This residue clings to the teeth and the delicate oral tissues. Because you lack the flushing action of sufficient saliva, this sugar residue sits longer, creating a perfect feeding ground for harmful bacteria. This significantly increases your risk for cavities and gum disease, which compounds the pain and discomfort of dry mouth. The smart swap here is to strictly prefer xylitol, erythritol, or stevia-sweetened products over conventional sugar, *strive. These alternatives provide the sweet taste many people crave and also stimulate saliva, but without feeding the cavity-causing bacteria. Xylitol, in particular, has been repeatedly linked to actively inhibiting harmful bacteria growth. Look for sugar-free chewing gum and sugar-free hard candies that list xylitol as the main sweetener. This allows you to get the salivary stimulation benefit of sucking on a candy, which we encourage, without the severe dental drawbacks. It is important to check the labels of cough drops or throat lozenges too. Often, people use these for throat irritation associated with dryness, but many are packed with sugar. If you must use them, seek out sugar-free varieties. The basic principle is to eliminate any source of sticky, lingering sugar exposure, especially when you know your natural saliva flow is compromised. This choice is vital for long-term comfort and dental vitality. Now, let's talk about the specific environment of your mouth and what you can introduce directly to help. We've talked about what to avoid: alcohol mouthwash, high sugar, but what about something highly targeted? The next smart swap involves maximizing the moisture barrier within your mouth, particularly overnight. Mistake number 6, though not in the initial 5, is closely related. Schumber's snotty bork times, failing to use protective oral gels or moisturizing sprays, especially before sleep. Schumber's. Many people rely solely on drinking water, but water evaporates quickly. If you have severe nighttime dryness, just drinking before bed is rarely enough. The liquid disappears, and you spend the night breathing through dry tissues. The smart swap is to use a not moisturizing gel or spray as the last step before bed. Not. These products are specifically designed to be thicker and stickier than water or rinse. They create a physical, lubricating barrier on the roof of your mouth, tongue, and gums. This barrier slows down moisture evaporation throughout the night. Think of it like applying lotion to dry skin. It holds the moisture in place. Look for products that are formulated specifically for xerostomia and contain ingredients like enzymes or lubricating polymers. Applying a thin layer of gel to your tongue and inner cheeks right before turning off the light can dramatically reduce morning discomfort. This is one of the easiest habits to adopt and provides some of the quickest relief for the discomfort associated with sleep. It is a targeted, practical solution that recognizes the unique challenge of overnight dryness. This little investment in a specialized gel can truly change the way you start your day. Let's bring this full circle by emphasizing the mindset that ties all these smart swaps together. The mistake isn't just in the habit itself, but in the mindless routine that surrounds eating and drinking. The final essential smart swap is mindful chewing and conscious hydration. We often eat while distracted, watching television, reading, or scrolling. When you are distracted, you chew less thoroughly, you sip less frequently, and your brain doesn't fully register the sensory input from the food. This impacts saliva production and taste perception. The solution is to dedicate a few minutes of focused attention to your meals. When you sit down to eat, consciously aim for 15 to 20 chews per bite, particularly with proteins and drier foods. This prolonged chewing acts as a continuous trigger for your salivary glands. It also breaks down the food into a much more manageable paste, reducing the effort needed for swallowing. Similarly, with hydration, be conscious of your sips. Don't just sip when you feel dry. Build the routine of sipping every few minutes. Keep your wetter water bottle visible and make it a micro-habit to take a small, intentional sip every time you finish a page in a book or during commercial breaks. This constant, gentle input is the opposite of the damaging chug and dry cycle. By bringing intention to your chewing and sipping, you are actively participating in your own recovery. This mindset shift transforms eating from a mechanical process into an active, enjoyable, and therapeutic experience. You are giving your body the best possible chance to combat the effects of dryness. Reclaiming your enjoyment of food starts with being present at the table. Remember all the tools you now have. We covered how to hydrate effectively, what not to put in your mouth, which foods to prioritize, and how to maximize flavor through aroma and specific agents like acid and umami. You now have a complete toolkit to fight back against dryness and tastelessness, built entirely on evidence and simple daily changes. If you are ready to take action and enjoy your food again, make sure you check your bathroom cabinet right after this video. Toss the alcohol-based mouthwash. That is your first, immediate step toward lasting comfort. Hit the notification bell so you don't miss our next video, where we dive into the best gentle movement routines for seniors. Thank you for joining Silver Smile and Bites. Keep smiling and keep savoring those bites. We have reached the end of our comprehensive guide, and now I want to provide a quick summary of the 6 essential smart swaps, leaving you with a crystal clear checklist you can apply immediately. First, your hydration habit. Swap *chugging *plain water for *sipping *slightly enhanced wetter water. Second, your oral hygiene. Swap *alcohol-based mouthwash * for a soothing xylitol rinse or gel. Third, your snacking choices. Swap *does gel, crumbly snacks for does gel, moist foods like yogurt, applesauce, or dipped breads. Fourth, your cooking method. Swap plain cooking for torcadore, aroma, and flavor-boosting utilizing fresh herbs, umami, and acidic notes. Fifth, your daily consumption. Swap unregulated diuretic consumption, naruma, narapatea, striking narapatase, namarapates, namarapatase, natrapatase, narafatase striking nara, namarapatase, narapatase striking vastrix, naira. And finally, our added secret weapon for nighttime comfort. Swap * doing nothing before bed, * for applying a * moisturizing oral gel or spray. These 6 swaps move you from making mistakes that worsen your symptoms to adopting habits that actively promote saliva production and oral comfort. It's about building a defense system. You don't need expensive gadgets or miracle cures. You need knowledge, consistency, and a commitment to these small, smart changes. If you know someone, a family member, a friend, or a caregiver who is struggling with the frustrating cycle of dry mouth and tasteless food, please share this video with them. This information can truly improve their quality of life. Improving vitality after 55 is about solving these practical, everyday problems, and we are here to help you do it simply and effectively. Remember to subscribe for more reliable guidance, and never give up on the joy of a good meal. Before we close, I want to briefly touch upon the connection between dry mouth and gentle movement, bringing in our channel's third pillar. It might sound unusual, but light exercise is linked to improved systemic health, which includes your salivary function. The mistake here is often *drum, assuming dry mouth is purely a localized oral problem. *drum. It's not. It is a systemic issue related to overall hydration and circulation. The smart swap is to * incorporate gentle movement daily. *not. Even a simple 15-minute walk, a session of light stretching, or some gentle seated exercises can boost your circulation. Improved blood flow helps ensure that all parts of your body, including your salivary glands, receive the necessary nutrients and hydration signals. Furthermore, gentle exercise helps manage stress, and stress is a known factor that can temporarily suppress saliva production. You're addressing the problem not just locally, but systemically. This doesn't mean high-intensity cardio. It means finding enjoyable ways to move your body daily. Maybe it's dancing to your favorite music for 10 minutes, or working in the garden. Whatever it is, consistent, low-impact activity supports your overall vitality and indirectly helps keep your oral environment balanced. So let's look at your day one more time. You start with wetter water, you move your body gently, you eat a moist, flavorful breakfast. You are now actively promoting the well-being of your salivary system from morning until night. These small, interlocking habits create a powerful positive chain reaction. Remember, every step matters. If you found this information valuable, give the video a like and tap that bell so you don't miss our upcoming deep dives into gentle movement routines tailored for you. Your journey to better health and renewed flavor starts now.